The next virulence factor is adenylate cyclase. We know that this is an enzyme. Let's suppose this is the bacteria, Bordetella pertussis. It will produce the adenylate cyclase and will export it to the outside of the cell. When the macrophages and neutrophils comes to the inflammatory region, these will take this adenylate cyclase, and when taken by these cells are inactivated with diminished bactericidal activity, so the bacteria has more chances to live there. The next toxin is tracheal toxin. The tracheal toxin is basically a protein, and it will combine with the endotoxin and produce nitric nitric oxide, and this nitric oxide will kill the ciliated cells. Now coming towards the clinical finding. The disease caused by this organism is divided into three stages. The first stage is incubation period. Incubation period means the period between the attack of the organism and the appearance of the symptoms. So it is from 7 to 10 days, means first week is of that of incubation period. The second stage is catarrhal stage. It is from 1 to 2 weeks, and in this stage cold like symptoms appears. The patient feels that he has cold. There, the clinical diagnosis cannot be done on this stage because the symptoms appears to that of the cold, but the laboratory diagnosis may be done most effectively at this stage because the organism grows mostly in this stage and culture can be done. The third stage is paroxysmal stage. It is from second to fourth week, from 2 to 4 weeks. Okay, in this stage the cilia is damaged, so the typical sign of woof, from which the name of the disease came, it occurs. Now I'll explain why it is called woofing cough and how the woof occurs. So in this disease there is fast and quick severe cough. So all the air is gone out of the respiratory tract to the outside environment. Then following this there is sudden inspiration through the narrow glottis, and this sudden inspiration through the narrow glottis produces the specific typical sign, which is known as whooping cough, like this. First there is fast severe cough like and then there is woof like okay. There may also be anoxia due to this fast severe cough. Okay, the fourth stage is the convalescent stage. It occurs after the fourth week. It is also known as the recovery stage, but there is chances of secondary infections like pneumonia occurs at this stage. Okay.